Today, I'd like to delve into a vital topic concerning men's health, the prostate gland. Often underestimated, this small organ, roughly the size of a walnut, holds immense significance in every man's physiological well-being. Astonishingly, prostate cancer stands as the predominant form of cancer diagnosed in men. Thus, a nuanced understanding and proactive approach towards its health become indispensable. Nestled just beneath the bladder and anterior to the rectum, the prostate encircles the commencement of the urethra, the duct responsible for channeling urine from the bladder. This strategic placement implies that any dysfunction or ailment related to the prostate can directly impinge on urinary and reproductive functionalities. Broadly speaking, men's prostate health can be threatened by three primary conditions. Firstly, there's prostatitis, marked by infection or inflammation. Secondly, benign prostatic hyperplasia is an age-driven enlargement of the prostate, often benign but problematic nonetheless. Lastly and most ominously, prostate cancer emerges when malignant cells proliferate within the prostate, with potential risks of spreading elsewhere. Recognizing the intricacies of this gland is paramount, for early awareness and timely intervention can make all the difference. Function of the prostate. What does the prostate do in a man's body? Often referred to as the second heart of a man, the prostate gland holds paramount significance in a male's physiological system. Beyond its primary function of producing a vital secretion that amalgamates with the semen, this gland plays a decisive role in the very essence of male fertility. Its secretion is not just an additive, it is the elixir that boosts sperm motility, enhancing their capability to journey forth and successfully rendezvous with the egg. Moreover, acting as a protective barrier, the prostate defends the bladder from infections, ensuring the urinary system's optimal function. And its ability to rhythmically contract bestows the vital force behind ejaculation. Given its myriad essential roles, likening the prostate gland to the second heart isn't merely poetic, but a testament to its crucial function in male vitality and reproductive success. Positioned as both a glandular and muscular entity, the prostate is undeniably central to the male reproductive system. When it comes to the act of ejaculation, this mighty organ becomes the epicenter of activity. Nestled within the prostate are intricate ducts, furnished with cells that produce seminal fluid. As ejaculation unfolds, this fluid journeys into the urethra, the conduit responsible for expelling urine from the bladder. This prostatic fluid then mingles with sperm, birthed in the testicles, and with secretions from the seminal vesicles. Architecturally, the prostate boasts a bilobed structure, with distinct right and left sections. Its broad base lies snugly against the bladder, while its tapering end, known as the apex, is in proximity to the rectum. Situated between these 2 points is the central glandular region. The significance of these anatomical distinctions amplifies when delving into the realm of prostate cancer. The prostate's specific region affected by the cancer can have profound implications on the manifestation of symptoms, the spectrum of treatment modalities, and the eventual prognosis. A pivotal organ within the male anatomy, the prostate is regrettably not immune to health challenges. Throughout their lives, a vast majority of men are likely to grapple with prostate-related issues. Broadly speaking, these issues often fall under three predominant categories, each presenting its own set of complexities. Firstly, there's prostatitis, which is an inflammation or infection of the prostate gland. Second, benign prostatic hyperplasia, BPH, is a non-cancerous enlargement of the prostate, often associated with age-related changes. Lastly, and perhaps most critically, prostate cancer emerges as a malignant growth within the prostate, representing one of the most prevalent cancers among men. Understanding these conditions is pivotal, as early detection and intervention can significantly influence outcomes. Prostatitis, simply put, is the inflammation of the prostate gland, but its manifestations and root causes can vary significantly. Two primary classifications emerge when discussing this condition: acute and chronic prostatitis. Acute prostatitis typically traces its origins to bacterial infections and presents itself rather suddenly. Men with this condition often experience agonizing urination, a diminished urine flow, and accompanying systemic symptoms like fever and chills. On the other hand, chronic prostatitis, sometimes referred to as chronic pelvic pain syndrome, is more enigmatic in nature. Those afflicted experience enduring or sporadic pelvic discomfort, a burning sensation during urination, an intensified need to urinate, challenges in completely emptying the bladder, and even discomfort during ejaculation. The intriguing aspect of this chronic variant is its elusive root cause. While ongoing inflammation, either with or without the presence of an infection, might be implicated, pinpointing an exact reason for the myriad of symptoms often remains a conundrum for medical professionals. Benign prostatic hyperplasia, BPH, is often colloquially termed as an enlarged prostate. This non-cancerous augmentation of the prostate gland predominantly emerges post the age of 50, marking it as a frequent age-related concern for many men. In fact, during the latter stages of a man's life, the size of the prostate might expand two- or even threefold. While BPH and prostate cancer are distinct conditions, it's crucial to note that they can coexist. Although BPH can be perceived as a natural progression of aging in males, its manifestations vary. Remarkably, nearly half of the men with BPH may not showcase any overt symptoms. However, for those who do, the repercussions can be bothersome. As the prostate gland enlarges, it constricts the urethra, the conduit responsible for transporting urine from the bladder through the penis. This obstruction compels the bladder's muscular walls to exert more effort, leading to potential urinary challenges, which can range from difficulty starting urination to frequent urges to urinate, especially at night. Prostate cancer, akin to other cancer variants, emerges from an unchecked proliferation of cells. This malignant growth within the prostate can manifest in various forms. It might remain localized, confined strictly to the prostate. It can be regionally extensive, extending its reach to neighboring tissues, or it might assume a metastatic nature, invading distant bodily sites. It's heartening to note that the landscape of prostate cancer management has witnessed remarkable advancements in recent times. Enhanced screening protocols, state-of-the-art diagnostic tests, and cutting-edge treatment modalities have collectively revolutionized the way we approach and treat this prevalent male malignancy. Thank you for tuning in. If this video resonated with you or offered insights you found valuable, do consider sharing it with those close to you. It's an excellent way to spread knowledge and potentially benefit someone's life. And if you're intrigued by what you've seen and eager for more enlightening content, make sure to hit that subscribe button. Stay informed and never miss out on our upcoming videos.